name is Alanna Geary and I am the Chief Nursing and Midwifery Officer for Metro North Health. Metro North Health in Queensland is the largest health service in Australia, and it is a role that I am so desperately proud to be in. I have professional oversight for 9,500 nurses and midwives in probably the most complex of healthcare industries. We have two large tertiary facilities in Queensland in Metro North, the Royal Brisbane and Women's Hospital and the Prince Charles Hospital. We have two large regional facilities, Redcliffe Hospital and Caboolture Hospital. We have Kilcoy Hospital, which is a lovely little rural community. Woodford Corrections, we provide primary health care to prisoners at Woodford. And we have the community and oral health services, so providing community services to all of those in our catchment. It is an amazing role. I am so proud to be in it. I'm so proud of the 9,500 nurses and midwives that I lead every single day. My role is to make sure that we maintain standards of care. Clinical standards are my bread and butter. They're what keeps me awake at night. When I think that we are not delivering appropriate services to the patients in our care, that's when I have my 3 o'clock sleepless nights. But overall, I am very committed to making sure that nurses and midwives in Metro North actually have the best working experience that they can, and therefore the patients that come to our services and their families receive the best possible care. There are a number of key turning points in my career. I guess the first one was being told that I might like to rethink my career trajectory, and that was actually told to me very early in my career and 3 times in those first few years. For somebody like me, that's like waving a red flag to a bull. I really believed that I was a good nurse, that I had strong morals and ethics, and that I could do the job that I was being paid to do. Now, others at that point in time obviously didn't see that, but I actually moved through that, built some bridges and moved on and found areas where I was valued. I've been very blessed in my career. I've actually had people who believed in me, not only some of my amazing family, but friends and colleagues. And I've had a number of senior leaders who I've actually aspired to be and be like. And that has really made my journey so much easier. I've also been fortunate enough to be provided opportunity, and my advice to anybody looking at achieving a leadership role is take every opportunity that you can get. Have the chance. If you have the chance to do something that's a little bit outside the box, do it, because it puts you out there, it puts you in front of people, it puts you in front of decision makers, and provided you're articulate, that you can string a sentence together, you can speak about what you believe in, then you will do well. If you'd told me 20 years ago that I would be the chief nurse of the largest health service in the country, I probably would have told you had rocks in your head. It wasn't anything that I actually aspired to be. I was a really good bedside nurse, and I loved bedside nursing, and I greatly value my colleagues who stay at the bedside. I guess if you take opportunities and people do see leadership ability in you, then you jump at those. But I do believe that what I do now actually informs the journey of nurses on the floor and actually helps them achieve the best that they can achieve as well. I honestly believe my best gig is the gig that I'm in now, but I've had many outstanding opportunities along the way. For example, I was in charge of a dialysis unit many years ago, and if you'd asked me to dialyse you, I probably would have caused you some harm. Dialysis was not my area of specialty, but it was about leadership, it was about believing in people, and I think one of the key messages for any leader is surround yourself with the people who have the skills that you don't. We don't all have everything. So you find the people who have the skills that you don't, and you grab them and you surround yourselves with them, and you make sure that they are given opportunity as well. I think one of the key attributes of a good nurse is resilience, and resilience is a word that gets bandied around quite a bit in the last few years, and certainly we've been through probably the toughest health crisis that we'll see in our lifetimes in COVID-19, but resilience is really important, and it's also about personal resilience as well as professional resilience. So being able to rise above the challenges that you have and bounce back, and I think nurses are inherently good at it. I think we have a very fatigued workforce, but we're fatigued for lots of reasons, and it just isn't the people that we're looking after every single day. It's about what's happening in society more broadly. It's about changing demographics, it's about the pressures that our families and friends put on us. Not intentionally, they're under the same pressures that we are. But I think being resilient is a key component of being a good leader. I also think it's really important that nurses understand that they are absolutely pivotal to the care and delivery of care for patients and their families. And it is really important that you remember that the patients cannot be without you, that you are so important, that you are the one person that sees them 24/7. The ability to use those skills to actually drive and change health is actually so important. So every nurse is a leader in their own right. It doesn't matter whether you're the assistant in nursing on the floor or whether or not you're the nurse unit manager or you're the chief nurse. We all have a role to play and we all have a leadership responsibility. Executive leadership is about understanding the strengths and weaknesses of all of your team members, about working with executive leaders. It's about working with a broader interdisciplinary team. As a nurse and a midwife in health, it is really important that you surround yourself with other colleagues who don't have the same skill set that you do, and that you don't have the same skill set that they do. I find it absolutely heartening when I'm sitting in a room with a number of executive leaders and we all have a different viewpoint. It doesn't necessarily mean that we don't agree with each other. We don't have to agree with each other, but it is really important that we acknowledge that each of us brings something very unique and different to the executive table. And for that reason, it is why functioning executive teams work really well together. Take every opportunity that comes your way. Think about what you're doing. Place yourself in front of people that can actually see what your strengths are. Make sure that you use people who, and when I say use people, let's not necessarily use them to get where you need to be. You have to be very careful. My mother used to always say, be careful of the people that you hit on the way up because you never know when you're going to hit them on the way back down. And that's a really important message. People need to know that you're there for all the right reasons. There are always going to be people that you don't necessarily agree with, that you don't necessarily think are doing the right thing. You need to rise above the challenge. Leadership is tough, and sometimes you have to make decisions for the greater good that will individually affect somebody adversely, but you make the decision based on what is the right thing to do. You do it in a kind, considered and compassionate way, and 9 times out of 10, kindness, compassion, caring, consideration and good leadership will get you to where you need to be. As an executive leader, and I'm a nurse by background, I trained in a hospital 42 years ago, and now you know how old I could possibly be. I actually believe that by making sure that you are visible, making sure that you are actually providing frontline services. In COVID-19, I actually went down to the vaccination hubs and vaccinated. One, I have vaccination skills. I was an infection control nurse for many years and many a flu shot was given by me, so that was well within my skill set, was well within my realm, but it also made sure that I had credibility. I was willing to be out there. I was willing to work alongside my colleagues. I worked with some amazing nurses and midwives. I got to talk to them one-on-one. I got to spend time with them. I got to know what actually brought them to work every day. I know what my own personal drivers are, but I don't know what everyone else's personal drivers are. So by actually working on the front line, by actually providing services to patients, I not only got to talk to patients, and I actually think that's one of the most wonderful things about working in the healthcare industry, but I actually got to talk to my colleagues and I had some amazing insights during that time. So putting yourself out of your comfort zone is actually a great thing. I haven't worked in a clinical ward situation, providing direct patient care for a very long time, but I'm very sure that I could actually deliver care with a couple of weeks of good orientation and preceptorship. I think that I have maintained my skills, and I think that all executive leaders need to ensure that they do that so that they actually do have credibility amongst their teams. Wellbeing and looking after yourself is so important as a nurse. It is absolutely vital that you have time to look at you and what makes you tick. Personally, I am a grandmother of 3 absolutely delicious grandchildren. I'm the mother of 4 absolutely amazing young people. I am a wife, I am a daughter, I am an auntie, I am a sister, and I take all of those roles very, very seriously. This afternoon, after I finish this interview, I'm actually going home to make what we call family dinner so that I can reconnect with my family. And one of the things I love is that I can actually park my work at home in those few short hours to spend some much loved time with family and friends. It is so very important that when you leave your work at the end of the day, however long that day is, that you have time to switch off and look after you. And whatever makes you happy, whatever makes you turn up the next day for work is so very important that you maintain that.